Hi, I'm Sue, and I'm a physical therapist assistant here at Mangiarelli Rehabilitation, and I wanted to tell you a little bit about aquatic therapy. This is our therapeutic pool. It's called a therapeutic pool because it is warm, so it's not a swimming pool, and you wouldn't want to swim laps in this pool or do water aerobics or anything like that because it's warm and you would become overheated. So it's meant for low intensity kinds of exercise. It's a very good medium of exercise for people who are deconditioned, for people who are very weak, and for people who have a lot of pain. Because the water is 94 degrees, and when you get down in the water, you're a lot lighter than you are on land, and your arms and legs are lighter, and your joints are decompressed, so you don't have as much pain when you work in the water, and it's a lot easier to move in the water. But just because it feels easier to move doesn't mean you're not getting a good workout or that you can't get stronger, because when you move through the water is the resistance. And you can increase or decrease the resistance in a couple of different ways. So the first way that you could make it harder would be to move faster. So as we increase speed in the water, we increase resistance. So when you first start off, you might start off very slowly, moving through the water, and just whether it's your arms, moving your arms through the water, or you're walking through the water, increasing speed increases resistance. The other way that we can increase resistance would be surface area. So if I had somebody moving their arms through the water like this would be like slicing the water, so that would be easier than if I had them move their hands like this, where they're pushing and pulling the water. You're going to get a little more resistance that way. And then once they're strong enough to do that without any problem, then I might put a piece of equipment in their hands. And so now this is even more surface area, which requires more strength and more resistance to push through. So those are some ways that you could progress. We also have noodles and things, noodles and dumbbells and things like this that use buoyancy resistance. So obviously these kind of pieces of equipment want to stay at the top of the water. So by pushing them down, you're having to use more force and more muscular strength, obviously, to push down. So something that's small is going to be easier to push down than something that's thicker. So we can use those kinds of things to increase your strength. But we can also use these things to help you. So when you hold on to these things, they'll hold you up and they'll float you. So we can, if we need to take the compression off your joints, we can use noodles to get you off of your sore knee or your sore hip. Or if your back is bothering you, we can take the compression completely off of your back. So there's a lot of tools we can use in aquatic therapy, and it's a great way to be able to get people moving again. And when we move, we feel better, and you'll get some pain relief working in the pool. So if you have felt like you just couldn't exercise because you're just too weak or too much pain and you didn't think that you could do the gym equipment, this is a great place to start. So, please give us a call. We'd love to show you our facility and get you started on aquatic therapy.